Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as methenamine. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe methenamine. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So methenamine exhibits antibacterial activity by the conversion of methenamine to formaldehyde in the presence of urine. The hippuric acid component has some antibacterial activity that acts to keep the urine acidic. In terms of indications or reasons we would prescribe this medication to a patient, well, this medication is typically used prophylactically or preventatively for recurrent urinary tract infections. With respect to contraindications or reasons we would not be able to prescribe methenamine, well, we wouldn't give this medication to a patient who had a hypersensitivity to methenamine or to any other component of the formulation. This medication should not be used with sulfonamides, and patients with renal impairment or kidney impairment would not use this medication as well. Patients with severe hepatic or liver impairment would be contraindicated to use this medication. And finally, it would be contraindicated in patients who have severe dehydration. Now for an example of dosing with methenamine. So when it's used prophylactically or preventatively for recurrent urinary tract infections, we would typically see 1 gram taken orally twice daily. And while using this medication, a patient would restrict the use of alkalinizing medications or foods. As with all medications, there are some side effects or adverse reactions that patients may experience while using methenamine, so we'll go over some of those here now. A rash may happen 3.5% of the time, and nausea may happen less than 3.5% of the time. Upset stomach comes in at 3%, and as well, 3% of patients may experience dysuria. Some serious side effects would be a hypersensitivity reaction or pneumonia. Alright everybody, that's all we're going to talk about today with methenamine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.